Thank you for that introduction, and thank you all for being here. In the pediatric ICU, as Jennifer mentioned, we have the responsibility of taking care of children that are really, really sick. We also have the privilege of seeing many of those children get better. And we also witness the miracle of transplantation and the hope and joy it brings to families. So I'm going to share some of what our hospital does, what our intensive care unit does related to those fields. As you know, we are your children's hospital. We have about over 250 beds, but at any given point in time, we have more than 280 children in various parts of the hospital. Sometimes we take over a few beds from the adult side, because we're at the pediatric hospital, we're the children's hospital for over 1.2 million children in the area. We have a 25-bed pediatric intensive care unit, as well as a 14-bed cardiac and transplant care unit, in addition to 84 neonatal ICU beds that I think Dr. Peverini talked to you about last year. We also take care of many, many children that are admitted to the hospital. I think over 15,000 admissions, many outpatient visits. We are the only level 1 trauma center in the area, so we get calls to transport critically ill children all the way from Blythe up to Barstow and from Corona to El Centro. So we serve a huge area. We work closely with Mercy Air and other ambulance providers in transporting these children safely to our hospital. We do about 1,000 transports a year, and a quarter of those are from hospitals in this area. So that's Desert Regional, Eisenhower, and hospitals in Indio and up in Joshua Tree. So about a quarter of the children that we get come from this area. As far as the transplant side, you all know about the infant heart transplant program at Loma Linda, pioneered by Dr. Bailey. And we now have over 500 children that have received heart transplants at Loma Linda, which is incredible. We also have a kidney transplant program and also take care of children before and after their liver transplantation. And currently we're following over 40 such children. So in the intensive care unit, we sit at this intersection of taking care of children when they're sick, some of whom don't get better, and we get to help the families decide whether or not they want to donate their organs as a precious gift of life. And we also then take care of the recipients and witness that part of the miracle of transplantation. We have in our ICU 25 individual beds, which let the families stay at the bedside. And most of the families, parents and grandparents, want to stay, and they're allowed to come in and out of the ICU as often as they want, 24 hours a day. So that's something we really encourage, is the family being involved at the bedside. We have a big multidisciplinary team. As you can imagine, this is a team sport, taking care of sick children. We have over 100 wonderful nurses. We have a transport team that goes out and picks up these sick patients. We have 9 board-certified pediatric intensivists, including myself, and there's 8 other colleagues. We stay in the hospital when we're on call, so we can attend to the transport calls that come in. We can attend to any code blue events that occur. And we also staff the rapid response team